You're listening to the Connection Care Community Podcast, a podcast designed to help you understand your body more deeply and feel more confident navigating your hormones, cycle, and fertility. Each episode offers grounded, research-informed guidance and integrative tools to support hormone health, embodied awareness, and informed choice. If you're seeking clarity, connection, and a more trusting relationship with your body, you're in the right place. Let's dive in. Here's your host, the founder of Connection Care Therapy, Majida.
Hello and welcome to the Connection Care Community Podcast. My name is Majida, and today we'll be talking about one of my favorite topics, rituals and practices for cervical health awareness, weaving cervical health and awareness into the everyday. So, hello there. Where I'd like to start this is taking us all the way back to when I first started to reconnect with my cervix. As I've mentioned in previous podcasts and Substack articles, I really did not have a relationship like most women, did not have a relationship with my cervix outside of pathology, right? You go to the doctor, they do a pap smear, okay, they engage your cervix, or sexual encounters, right? So someone else is engaging my cervix. But me, myself, I never learned or knew that I could have a relationship with my cervix until I started to do cervical position checks for fertility awareness practices. So when I first started, I just wanted to understand my cervix. I wanted to map its changes, understand what's normal, interpret what it was telling me, right? Make sure to collect the data points. But over time, I realized that awareness wasn't just about observation, and it certainly wasn't just about collecting data. It was really about forming a relationship with my cervix, right? With a deep and beautiful part of me. And like every relationship, connection deepens when there is consistent care, the kind of care that is slow and intentional and embodied. So in this post, right, I really want to introduce you to some of my favorite everyday rituals that can support your cervix and your overall reproductive system feel more nourished and supported and safe and cared for. So, the cervix as a barometer for balance. As we have talked about throughout this podcast series, even though your cervix is a really, really powerful and amazing marker of fertility, it's not just a marker of fertility, right? It's a marker of your whole system wellness. It's an extension of your uterus, as we know. This means that it's rich with blood vessels, that nerve pathways respond to both hormonal cues and emotional cues. Its tissue is also dependent on things like adequate circulation, balanced hormones, a regulated nervous system, which means that lifestyle, nutrition, stress management, all of these things play a direct role in your overall cervical health. In functional medicine, we highlight how chronic inflammation, nutrient deficiencies, or impaired detoxification can influence your cervical cell health. You also have research that shows that folate, zinc, vitamin C are all crucial, absolutely crucial for your cervical tissue integrity and overall immune function. And then you have studies that are also have been documenting the association between low folate and cervical dysplasia, because folate, plays a critical role in DNA synthesis and repair. But what's equally important and oftentimes gets under discussed is how tension in the pelvis or an overactive stress response can affect your cervical tone and receptivity. So in the last podcast, I talked about how the vagus nerve innervates the cervix. It creates a direct pathway between your nervous system state and your cervical function. When you're in a chronic stress or sympathetic dominant state, the blood flow to your reproductive organs can oftentimes decrease. The cervix can become firm or tense or less responsive. What this is showing is that cervical health operates on multiple levels. It operates on the biological, the nervous system level, the energetic, the emotional level. And so, if we're talking about cervical health, it's important that we care for ourselves and our cervix through all of these dimensions, that we support the body's innate rhythm and repair and renewal by being integrative, right, and whole system responsive and considered. So, starting out with the rituals and the practices that support our cervix are part of tapping into, right, the nervous system and the energetic and the emotional aspects of this conversation. Starting us out with gentle pelvic circulation practices. And so I'm going to name several here. This is a point where if you haven't yet grabbed a pencil and a pen, you definitely are going to want to take some notes. Or you can head on over to my Substack. Please do head on over there and please do subscribe. And you can see this information listed there so that you can actually start to engage some of these practices in your life. So, starting out, gentle pelvic circulation practices. Blood flow is everything for tissue health. And the cervix is no different. Like all mucous membranes, it's going to require consistent circulation to bring oxygen, to bring nutrients, immune cells, right? All of this while also doing the work of clearing metabolic waste. So I learned this during my recovery from adrenal fatigue, when my pelvic felt chronically tight, almost numb during this time, when I started to incorporate just 5 minutes of gentle hip circlings, pelvic breathing exercises, as I talked about in the last podcast. I would do pelvic tilts each morning. I started to notice massive changes within probably like the first couple of weeks of doing these practices consistently. I started to notice that my cervical fluid would become more abundant, that my cervix would become more responsive when I checked it, that overall just the tissue quality and responsiveness improved. So some simple movements that can increase pelvic circulation. One, you have slow hip circles. There's a reason why belly dancing and other hip-oriented African dances and what have you are deeply associated with feminine energetic cultivation, and those are tightly, closely linked to feminine health, right? Cultivation. So slow hip circles. You can stand with your feet hip widths apart, your hands on your hip, and make slow, wide circles with your pelvis in both directions. I offer that you start out with 5 circles each way and make an intention of doing that twice daily. The cat-cow tilts, any of us who have done any kind of yogic practice knows the cat-cow, where you're on your hands and your knees and you slowly arch your back and round your spine. For extra effect, if you like to stick your tongue out during this time, is one that I personally like to engage all the way from my mouth all the way down through to my yoni. So you're arching your spine up and then arching it back, right? Doing this pelvic tilt, cat-cowing, arching your spine by dropping your belly down, and then by lifting your spine up, arching it back, right? Keeping your shoulders in place, having the movement originate from your pelvis. Also, pelvic floor release, right? You may lie on your back with your knees bent, and as you inhale, you let your pelvic drop and soften, and as you exhale, you gently engage without gripping, right? You can do those, repeat those for about 2 to 3 minutes. And then hip opening postures. Baddha Konasana is a yogic posture. Bound angle pose is what is known as, or Malasana. That's a deep squat. Supported bridge pose. All of those poses, yogic poses, can support blood flow, encourage blood flow to the pelvic bowl. I encourage my clients to squat, right? If you can do a squat for 2 to 3 minutes a day, when I tell you just a deep squat, how powerful that can be on nervous system health, pelvic integrity and support, on also gut health as well. That's a big one, that it's one of our most natural positions to be in. For much of human history, that's actually how we would utilize the bathroom, is through a squat position. So do not sleep on a simple 2 to 3 minutes a day of in a squat position. Can be very, very, very powerful. So if you already practice yoga or qigong, pay attention to how your pelvis feels after sessions that emphasize hip opening. You may notice things like warmth or tingling or awareness in your lower abdomen. All of those are indications that circulation is improving. So, second one, nutritional support for cervical tissue regeneration. Cervical tissue regenerates quite rapidly, with cells turning over approximately every 2 to 4 days. This rapid regeneration makes the cervix particularly responsive to nutritional status. So when nutrients are abundant, cervical cells can repair efficiently. And when they are depleted, cellular repair can be slow, and there can be a vulnerability to things like dysplasia. So I'm going to speak about a few key vitamins for cervical health. If you want to head on over to my Substack, I actually list food sources and therapeutic doses there, so that you can actually grab that information for yourself and cultivate perhaps your own cervical health nutrition regimen. But I'll just do the overviews here, and then for the actual food sources and therapeutic doses, head on over to my Substack. So vitamin C, right? It's essential for collagen synthesis. It's going to support you in maintaining cervical tissue integrity. It's also going to support immune function at the cervical level. There is some evidence of supporting and clearing HPV and other pathogens. There's a reason why, right? Vitamin C is associated with immune system health. There was one study that found that higher vitamin C intake has significantly, women who had higher vitamin C intake experienced significantly lower rates of cervical dysplasia. So again, head on over to my Substack to see what therapeutic doses for cervical support are, as well as some food sources that you can tap into. Big one, you've heard it before. You'll all hear it mentioned quite a bit here on this podcast. Folate, which is vitamin B9. It's absolutely critical for DNA synthesis and repair. Low folate levels have been associated with cervical dysplasia, impaired healing. Folate deficiency can lead to abnormal cervical cells, changes that tend to mimic what are precancerous lesions, right? Not a small thing. Methylated forms, always look for methylated forms. And again, you can head on over to my Substack and also my supplement store on my website if you want to see what I recommend when it comes to things like vitamins that are methylated, making sure that your B vitamins are properly methylated, especially. And then we have zinc. Zinc is a big one for immune system function. It's huge for cellular repair. Zinc deficiency can impair the body's ability to clear HPV. And it also zinc deficiency can impair the body's ability to maintain overall cervical tissue health. I've worked with multiple clients whose cervical dysplasia improved after they address zinc deficiency. Not a small one. Do not sleep on zinc. And when you're dealing with zinc, you always want to make sure that is properly balanced out with copper. So again, head on over to my supplement store if you want to know the types of zinc supplements that I recommend. Omega-3 fatty acids. Those guys are going to be massive in reducing inflammation and supporting cellular membrane health. Chronic inflammation in cervical tissue creates an environment where dysplasia is more likely to develop and persist. So don't sleep on EPA, DHA, right? Don't sleep on your omegas, and make sure that you're getting those properly into your system. So the next one that we're going to talk about is supporting liver detoxification, because this is a big part of both the gut and the liver connection. Is a whole other topic that I'll get into on other podcasts, but to know that they're deeply connected and supporting your overall metabolic health, supporting and ensuring that your body is getting the nutrition that it needs, and and not being burdened by detoxification concerns, tending to how your liver metabolizes and clears excess hormones, including estrogen, actually, interestingly, can be a big part of your cervical tissue healing and support, and navigating things like dysplasia. Cervical dysplasia. So, supporting liver detox pathways can really support you in your overall hormone balance at a cervical level. Cruciferous vegetables like broccoli, like cauliflower, Brussels sprouts, kale, they contain certain compounds that are going to support phase 2 liver detoxification. And so looking to get between 25 to 30 grams of adequate fiber a day, it's important to ensuring that your system is properly metabolizing and eliminating hormones through your bowel movements instead of those being reabsorbed into your body. So when I have worked with clients with cervical dysplasia or those who are healing post HPV, I oftentimes recommend targeted protocols that include the nutrients that I just mentioned, plus liver detoxification support. As well as additional support for immune function and overall viral clearance. And that might include things like therapeutic doses of vitamin A, selenium, medicinal mushrooms, which have all been studied for their uses in supporting HPV clearance. But these are things that we get much more into if you're interested in actually working together. Yeah, you can head on over to my website, schedule a consultation if you're navigating something like a cervical dysplasia, HPV. Those are things that would need probably more of a intimate level support, and so booking a consultation would be your first step. So moving on to talking about breath work and nervous system regulation, something that we've talked about quite a bit on this podcast already. By now, you're probably pretty clear that your cervix responds to how safe you feel when your nervous system perceives a threat, right? Blood flow to your reproductive organs can decrease, as we've talked about, and your cervical tissue can become tense or less responsive. So the goal then is to support you in shifting into parasympathetic dominance, right? Your rest and digest, your rest and repose part of your nervous system, where your circulation improves and your cervix can soften and open. The pattern that I've seen is when clients are underneath chronic stress, their cervix can show minimal movement throughout the cycle, even when cervical fluid and other signs are doing what they do, right? That the cervix can be very responsible to a person's stress states. So the practice of doing cervical checks is not the problem, right? For individuals navigating this, it's that the practice is just simply reflecting restricted pelvic circulation and nervous system dysregulation. So what I invite those who are navigating these experiences is to integrate practices that can address the underlying stress problems. In my work, I tap into somatic therapy, into nervous system regulation, into breath work, into hypnotherapy. And in these practices really support and serve clients to improve their nervous system response, and then they see circulation improve, and then they see many parts of their system, including their cervical health, begin to improve. One practice that I will offer in this podcast is diaphragmatic breathing for cervical relaxation. And so this practice can activate your vagus nerve, which, as we talked about, innervates with your cervix. I invite you to explore this, right, regularly, to support this breathwork practice can support, right, in shifting your nervous system baseline and perhaps make it easier for your cervix to respond throughout your cycle in a more attuned way. So how do you do diaphragmatic breathing? You start by lying down, finding a comfortable place, placing one hand on your chest or on your lower belly, and then slowly inhaling through your nose for a count of 4. And while you're inhaling, the big part of this, important part, is that you're allowing your belly to expand, right? Your chest is relaxed and your belly is expanding. Kind of like when you're watching babies breathe, like, and they breathe big in their belly. And when you do that, you can take a gentle pause at the top, right? And then slowly exhale through your nose or your mouth for a count of 6, and allowing your belly to fall and soften and your pelvis to soften. So this simple breath pattern, I sometimes call it baby breathing because that's what I think of when I watch a little one sleep and their bellies are just expanding and relaxing, right? Doing that for even 5 minutes a day. Even 5 minutes a day can be extremely profound to reestablishing your baseline nervous system tone. You may notice when you're doing a practice like this subtle warmth, tingling, a sense of openness in your pelvic bowl. That would be increased blood flow and parasympathetic activation. So I invite you to practice this type of breathing, baby baby belly breath breathing or diaphragmatic breathing, before bed or after you've experienced something stressful, or it could be part of your morning routine. I would offer that consistency matters far more than duration. Pelvic bowl breathing, we kind of talked about this in my previous podcast, but that's another practice. I invite you over to the Substack if you want to take note of that practice as well. But that's another one that I offer you to explore. It's a simple, easy breathwork practice. So head on over to my Substack if you'd like to see the outline for that, and it will be in this article for the podcast that we're talking about now, as well as in the last podcast in this series. These are simple practices, right? Simple practices, but profound practices. And I invite you to just explore them at your own pace and see how they support you in releasing chronic tension that may be restricting cervical circulation and responsiveness. The next one we'll talk about is mindful touch and body listening. Gentle, external pelvic massage, right? External. If we were doing more one-on-one sessions or even in small groups, I could talk about more internal practices. But for the purpose of this podcast, and for many who may be beginning, starting externally can be quite profound and really beautiful and enlightening. So the goal is softening, right? Now stimulation. It can be really, really profound to know that your cervix can be supported even without requiring internal touch. So even if you have an internal practice, I invite you to explore, right, abdominal and pelvic massage externally. And those directions, again, are given on in my Substack. I invite you to head on over there to see what the directions are. I think it's more of a practice, unless I was leading you through it live, right? But since it's probably something that you're going to do more so on your own, go ahead over to Substack and check out the directions there. But sometimes when I do this practice, the abdominal and pelvic massage, I integrate castor oil and castor oil packs and castor oil therapy into my practice, which has been used traditionally to support pelvic circulation and reduce inflammation. So if you're going to do the massage, like I invite you to actually, and use castor oil, I invite you to actually warm the castor oil before using it. That can be like a nice gentle touch. And there's simple ways to warm it. Like what I oftentimes do is I pour a little bit of castor oil on my castor oil pack and then put that on top of the castor oil pack on the other side, not the castor oil side, but the other side, on a warm water bottle. And then once the castor oil warms up, I put that on my belly because I don't advocate for warming castor oil on the stove. And with that, then you can do a gentle massage, on yourself. 10-15 minutes can be really, really quite profound. Practicing presence, right? This is where I'll kind of start to just close up some of these exercises or practices and rituals that I'm sharing with you today. Even simpler than, right, the massage is the practice of just placing a warm hand over your lower abdomen and breathing with intention. Right? Inviting to either say the words out loud or to yourself, I'm here with you. I'm listening. You're safe. I've had clients just do this simple practice and who have told me that even this kind of presence changes how they experience their cycles, right? That their cycles come on with less pain, more sensitivity to hormone shifts, deeper ease. When we bring loving awareness to the part of our body that's often ignored, and approach it only with clinical detachment, has been approached with only clinical detachment, it can be really profound how just a simple presence practice can allow that part of us to begin to respond, right? So just inviting a practice of simple presence can sometimes be the only ritual that you need. All right, so moving into integrating ritual into your real life, I want you to know that cervical health doesn't require adding more overwhelming protocols to your life. It can be weaving small, sustainable practices into your existing rhythm. That might look like drinking a mineral-rich infusion like nettle or raspberry leaf while you journal in the morning, or taking 2 minutes in the shower to practice pelvic bowl breathing, or stretching your hips for 5 minutes before bed instead of scrolling on your phone. I'm also guilty of that. So, but yeah, that 5 minutes, right? Stretching your hips instead of being on your phone, or adding an extra serving of leafy greens and pumpkin seeds to your lunch. Your body thrives on consistency, not intensity. Your cervix responds to the ongoing message that is safe to soften, to be nourished, and to function optimally. So if you're in need of any guidance, if you're feeling unsure or overwhelmed about any of these topics or conversations, or you want a second pair of eyes on your chart to know that I've gotcha, you can check out my Cycle Connection course. I will support you in troubleshooting real-life charting challenges and support you, of course, through the lens of compassion and clarity. In that course, we focus on skill building without shame, on body trust without micromanaging, on community and support instead of going at it alone. So you can head on over to my website, connectioncaretherapy.com, or you can also head on over to Substack. And in addition to grabbing some of those rituals that I mentioned here but didn't outline fully, you can also check out the Cycle Connection course because the link is available there. If you head on over to my website, you can grab my free resource, Hormone Harmony. It's a wonderful complement to your charting practice. And then as a reflection to close this out today, I would love to invite you to pick one mindful practice this month to nurture your cervix. Maybe it's a nutrient-dense meal or a breathwork moment or gentle movement. And just notice how integrating that practice makes you feel. I'd like to remind you that your cervix does not need your perfection, right? It just needs your presence. And the more you tend to that presence, the more that it'll tend to you in return. So thank you for joining today. And I hope that you found this podcast useful. And I look forward to seeing you next time. All right. Stay connected.
That does it for this episode of the Connection Care Community Podcast with Majida. Thank you so much for listening. We hope you're leaving with a fresh perspective on your body and overall well-being, along with practical tools you can integrate into daily life. The support doesn't stop here. Be sure to connect with us online at connectioncaretherapy.com for more resources to guide you on your journey. You can also find us on Substack and connect with Majida on Instagram at Majida Sai'da. Remember to rate, review, and share this podcast. And most importantly, stay connected.